After days of surging COVID case numbers and hospitalisations, the Premier has been forced to act, restoring some restrictions. Dominic Perrottet also says COVID numbers will get much worse before the month is out, but the government's released new modelling to show hospitals are up to the task.
The Premier's backing in his COVID strategy, even as he's bringing back restrictions.
I think you would see exactly the same, and that's been brought out right across the country and right across the world right now. We are seeing exponential increases in cases right across the board.
After 3 days of more than 30,000 recorded cases, some modest restrictions are returning. From tomorrow until the end of the month, singing and dancing in hospitality venues isn't allowed. But that doesn't apply to weddings or performers. Major events can go ahead, but will have to go through a detailed risk assessment process. Indoor gatherings and drinking standing up are discouraged, but not banned. Non-urgent elective surgeries will also be delayed.
Can I be clear to those people on the receiving end? It is not a decision that we take lightly. It is not something that we consider unnecessary surgery.
Official case numbers are edging towards 40,000. There are more than 1,700 people in hospital, with 130 in intensive care. 11 people have died. State government modelling shows the Omicron wave is expected to peak towards the end of January. In the most likely scenario, 4,700 people will be in hospital, with 273 in ICU. Even with staff furloughed, authorities insist this is within the system's capability.
We've revised down quite significantly the number of ICU beds available, for example, so that is indicative of the fact that we understand that to be able to surge ICU you need staff, so we've revised that number down.
Even on a worst case scenario, is in a strong position.
But doctors are sceptical.
It's very significant numbers, pushing very close towards the peak of what is capable to be managed within the hospital system. That's including the private system.
Despite that peak in hospitalisations coinciding with the return to school, Dominic Perrottet is promising students will be back in class on schedule.
Our commitment is to get kids back in the classroom day one, term one.
With official case numbers considered to be an underestimate because they only include PCR tests, the government is now working on a system to register positive rapid tests through the Service New South Wales app, so COVID patients can be better linked into healthcare. Kathleen Calderwood, ABC News, Sydney.
And Kathleen joins us now from Chinatown in Sydney. Kathleen, the removal of restrictions was meant to give businesses the freedom to flourish, but it seems cautious customers are staying away.
That's right, Jeremy. While we may be free to go shopping and eat out, Sydney is actually experiencing something of an economic lockdown. The latest data from ANZ shows that spending in Sydney is at its lowest since the pandemic began. They've attributed this to people being cautious over the holidays, with staff shortages due to rising infection numbers adding to the problem. This is a blow for Dominic Perrottet, who's really staked his career as Premier on his economic credentials. He's pushed to lift restrictions and has often spoken of offering hope and optimism to the state as we go through this pandemic.
Opening up is the best thing we can do for our economy. Now, clearly, in the middle of a pandemic, when cases rise, that will dampen confidence. But ultimately, the alternative is to lock down.
With 2 to 3 weeks before the Omicron wave is expected to peak, Jeremy, it's unlikely confidence will pick up soon.
Kathleen Calderwood reporting. The Tamworth Country Music Festival is the first major victim of today's COVID changes. With just 1 week to go, organisers say they faced too much uncertainty around risk assessments, and they've postponed the event until April.
The new restrictions: no song and dance for one of the state's biggest music festivals.
It was with a very heavy heart that we've made that decision, and I think that there's not one person in this organisation that is happy about it.
It's not what the state's Chief Health Officer had in mind for Tamworth's Country Music Festival in announcing risk assessments for major events.
Clearly it will change the character and flavour of some of those venues and significantly reduce the risk, but I think that's a matter for the organisers.
But a week out from showtime, they say they had no choice.
There was so much uncertainty around what we would have to do to comply with the law, to comply with the health orders and carry this festival through in a safe way.
On the hospital front line, there's support for a short shutdown of non-urgent surgical procedures until February.
It is really important that we don't have these at all if we can, but when it's unavoidable, then we also need to make sure that we come together and have a plan to look after the patients who are urgent.
But emergency doctors say the government's figures focus too heavily on ICU capacity.
The Premier needs to know that the numbers in the modelling don't necessarily reflect the pressures on emergency departments and primary care settings well, and we're all going to need to pull together.
Being unable to sing and dance is a disappointing start to the new year for many.
I would be feeling fine if I had 5 weddings to go to over the next month, but I don't, so I'm very devastated about not being able to dance.
For me, if we're not allowed to dance in the club, I thought the same policy should be applied to the weddings.
But a motivator for others.
I suppose I'll probably be proposing to the girlfriend here now today, now that I found that out, be able to drop a few more shapes.
Despite the changes, there's some optimism in the hard-hit art sector. The cast of Girl from the North Country, preparing for their Australian premiere in Sydney, just relieved their opening won't be affected by the new rules.
We just keep going. That's all you can do. Maybe the Premier will even come if his rules don't change too much.
The show goes on. Emily Lawrence, ABC News, Sydney.
Authorities are urging people not to stockpile food as supplies become patchy in parts of the country because of COVID. Supermarkets have run out of some products. There's no shortage of food, but rising COVID positive cases and the isolation of close contacts have reduced staffing and disrupted supply lines.
Every Australian has to be part of this solution. What we're asking is that you actually don't go out and buy unnecessary amounts of a whole range of different products and hoard. What we're asking is that you buy what you need.
A national task force is working on a new COVID testing system it hopes to have ready within days to get people back to work faster.